welcoming you all to our YouTube channel, Medical Online. I welcome you all here. This is our first live video, and in this video, we are going to talk about the new variant of COVID-19. Anyhow, let me check if anyone is here with us. Kindly join us and share your opinion about everything. Okay, let me share it with people who are there on Facebook. Please stay with us, don't go anywhere. Okay, so one person is watching us live, and let's see how many people are there. If you people are here, kindly do like and also subscribe our YouTube channel. And in this video, I'm going to talk about the new COVID-19 variant, which is also called Omicron, and this was named by WHO after it first appeared in South African countries. Okay, so let's talk about things. First of all, in South African countries, a surge of new COVID-19 cases was reported, and it was too much in number. Like it sudden increase, and the doctors and scientists there were really worrying because whenever they think that they have got many new COVID cases. So after that, they got the point that it's the new variant and it's the new mutant, and then WHO called it as Omicron. Okay, so the main thing about this, and the world is worrying a lot because of its transmission and infectivity. Like previously, if we will compare it with the Delta variant, its transmissibility was 60%, but with this one now it's about double of this Delta variant. So that's the main reason most of the people and most of the world is worrying about this one, and they want to stop there in South African countries. And the travel ban and all this stuff, they're going to be happen in near future, and we'll see maybe many those countries who are still vaccinating their population and unvaccinated people are there, they are worrying too much because in the start they have also noted uh, some cases in those people who are vaccinated, but now with time passing, now we are getting more data, and in the new data it came out to be that new variant is also not that much dangerous in case of symptoms. Because okay, let me talk about symptoms as well. And just today we got a new data, and it shows that the new variant is not that much dangerous in symptoms. The symptoms are mild, especially it could be mild fever and body aches. These two symptoms are till now noted, and it's not that much dangerous. Like it is the same as it was previously. But the main thing which we are, and the different countries are want to stop it there, is its transmissibility and infectivity, because it spread a lot, and very soon it will spread throughout the world, and then again we will be having the same problem of lockdown. And so just due to vaccines, we were going to able to come to normal, and everything was going to happen in normal routine. But now again, due to this new variant we got, and it's going to be again the same. But yes, we can stop it there, and the same thing, if we will practice social distancing and wash our hands and wearing face masks, then we can stop it there in the same countries, and it will be definitely till that time that up to up till we will vaccinate our populations. And symptoms I'm telling you people is the mild fever and body aches. But yes, it could be dangerous in those people who are having some comorbid conditions, like someone who is having diabetes mellitus, or other person who is having hypertension, and also another person who is having some cardiac diseases. So it could be lethal for such people. That's why the world is worrying, and they are trying to stop there in South African countries, and different countries are or have already applied travel ban on South African countries, and many or other will also do in the near future, because if it's that much transmissible and up to more than 60% of more transmissibility, then it will really surge new cases, and many people will be having again the same situation. Like we will be having shortage of beds and in hospital, and definitely shortage of oxygen therapy and all that stuff. So that's the why we should stop it, and we should apply all the preventive measures first, just to prevent it. And the new data showed that everything was revealed that and those people who are vaccinated, who are already vaccinated, was less effective. In fact, this new variant was not that much dangerous for such people. So it's nothing to worry, because we are already having vaccine, and almost many countries have already vaccinated their population, most of the population, and they are still doing their good, and they're doing their level best to vaccinate their population as soon as possible to prevent from this new variant as well. But in future we will be having more variant as well. This is virus, and it could mutate, and now it's clear that any type of mutation can happen. It could lead to some more dangerous viruses as well. Mutation can happen. This is the main thing, and we should prepare ourselves, and our mind should be ready for this, that yes, it could be changed more. So, but yeah, the other side of the story is that if we will vaccinate our masses, and mm, then at least we'll be able to stop the burden on hospitals, because the vaccine effectivity or efficacy is almost each and every vaccine is about 60 to 90%. So if we can prevent of 60% of people from just vaccinating them, then it can really help you. In most other countries, people are worrying about vaccine things, like they are not that much, they are reluctant to be vaccinated. Don't know, different countries is having different stories, but each and every healthcare professional along with their families are already vaccinated. I personally got two vaccine and two doses of vaccine, and I'm vaccinated now. I have faced many COVID-19 patient, and previously in last April and May, I must say, I was infected with the COVID-19, and I was having some symptoms as well, like especially I was having body aches, fever, and mild cough as well. But this time, after 1.5 year almost, I'm totally fine, okay, and I have faced many more patients of COVID-19. But I think this is one of the reason uh, of that vaccine that I haven't got any other infection, secondary infection. So it's better to be vaccinated before it's too late. Many people are having this issue, and they're reluctant, and they're thinking, and many countries having different theories. Like I have seen and I have watched many different theories. I will also talk about that in the later on videos as well. But today or tomorrow you should be vaccinated, and this is the one step which we can prevent our masses, and we can prevent our elder who can be really in bad condition. Like if you will ask any doctor who is working or who has worked in COVID-19 isolation ward, they can tell you the difficult stories of the people who are already vaccinated, like those who are craving for oxygen, and they are in bad condition. So yeah, so it could be really bad situation if you avoid vaccine. Try to vaccinate your all elders, especially. You should vaccinate yourself as well. It's not like that, nothing will bad happen. Like just imagine the whole world is going to be vaccinated. If this is that much dangerous, how is possible? No one is ready to end the humanity and this earth. So it's better to vaccinate yourself. Yes, in addition to all these things, you should also remember one thing more, that all the preventive measures should be taken. Like you should wear face mask. This is another thing. Like it's now cold, and it can prevent you from other influenza and other things as well. So it's really better to vaccinate. I must say again, to vaccinate yourself. Okay, so one of the person, Nanda, has commented, "Hi sir, hello, how are you? If you people are having any question regarding any type of your health issue, I can give you answer. You should comment over here. But this video was specially for the new COVID-19 variant, and I was just trying to make some really simple picture of that new variant. Nothing to worry. It's not dangerous in symptom case. Like symptoms are really mild. It's only having mild fever and body aches. Don't worry about symptoms, but yes, its transmission infectivity is too much. Like it's more than that of Delta. Delta was 60%, and many are claiming that its transmissibility is almost double of that of Delta. So it's dangerous in that case. Like it transmit to other people very soon. So anyhow, but yeah, it's not like that. We will continue the same things and hope so that our vaccine will work against this new strand as well, because till now the data has revealed that almost all those people who were vaccinated were having really simple symptoms, like almost they were not having any infection. But yes, some infections have already been noted in vaccinated people as well. So uh, anyhow, so if people are having any question, you people can ask me. And yes, only two or one person is watching me. So this was my first attempt to go live on YouTube, and oh my god, yeah. Okay, so Nanda has asked it, sir, or indigenous vaccine still operating on? Yes, yes, you are absolutely right. It's working, and all the vaccines in the world which is available is working. Like if you are vaccinated with any of the vaccine, it can work. It can at least protect you from going to hospital to be hospitalized, and it's the same for all. And even the new data revealed that the new variant is not, like it's not that much dangerous in those people who is already vaccinated. So don't worry about that. Your vaccine definitely works against this new variant as well. And yes, if it will be in the future, if we got some mutation, some mutant like that, and it were not working, then definitely till that time we will get some time, and definitely uh, you will be having some problem in that case. Okay, reinfection is possible with Omicron. Reinfection can be with any of the COVID-19. It's not like that. You can be reinfected, but in the reinfection case, it will not be that much dangerous symptoms. You could be really in good shape because of that vaccine. Your body is already immune to that system. But yes, you could have some mild symptoms. But reinfection cases is now very rare after that very vaccines. And don't worry about anything, because most of the people are asking me some question about different type of vaccine. It's all the vaccine, I must say. I'm sorry to say, but yes, I will say that now the vaccine is like a business. Every country is preferring their own, and just urging the people to vaccinate with their own, because it's now a type of business. So, but yes, I'm telling you, every vaccine, either it is AstraZeneca, it's Pfizer, it's Sinopharm or Sinovac, any type of vaccine are uh, good, and yes, it can protect you from being hospitalized. Yes, the little bit difference is between that of efficacy. Like in some vaccines, you will be having efficacy of 60 to 90% or something like that, and the range is 60 to 90%. The only difference is between this. So I'm telling you again that the countries who are claiming their vaccine to be good, like just now we have received the data, and I think you people have already watched news that in Pfizer vaccine, the immunity decreased after 3 months. Previously, we were thinking that the good vaccine available now is Pfizer, but it's not like that. I'm not telling you that Pfizer is not good, but yes, you will need a booster of it again. But if you have received full dose of your vaccine, then definitely it can prevent you from being hospitalized. And all those people know who were previously infected. Like personally, when I got in this infection, it was really like I was in the start of the people. I just operated on a person who was having COVID-19, and my other colleagues with me who assisted me were also positive, and all those doctors who had done their duties that time, they were also positive in that time. But unluckily, that patient died, and after that, we got to know that he was COVID-19 positive. and we all the doctors and all the teams who faced him and who were there got infected. I personally was not that much having symptoms, like I was just having body aches for 2 or 3 days, mild fever as well, but the remaining things were good. But now, when after my vaccination, I'm feeling really good. Nothing happened bad with me. I'm facing a lot of COVID-19 patient now, and almost on daily basis, because in the country where I'm working, most of the people are electing to be vaccinated. Uh, and this is reality. Most and the whole world, some people are just thinking like creating negative theories about vaccines. Okay, so if you people, I hope that Nanda has got his answer. I don't know, he or she, anyhow, but that I tried to give you answer. Thank you, welcome, always welcome, Nanda. If you have any other question in your mind, you can also ask me. It's not only related to COVID-19. You can ask me any other health related question. I just got up now and just received the data from there, and I read the article, and I just think that it should be shared with you people as well. Okay, and I'm trying to give you a brief review of all other medical condition in this platform. You will can ask me as well if you are having any problem. I think this was enough for today, and tomorrow we will again go live on the same time, and we'll be trying to give you a brief other changes which could happen in the near 24 hours. Okay, thank you so much for watching. Take care. Bye bye.